All right, let's talk about kidneys, carnivore, and diabetes. So I have a number of patients right now, and we're trying to get their kidney health back up into a good range, and we're using some lab tests to measure that. The biggest lab test that I like to use is called GFR, filtration rate. Another one is called creatinine. So there can be different causes for the kidneys to not work very well, but most commonly across the United States, there's just too many carbs and too much sugar, that kind of a diet. And the glucose in the blood being high can damage tissue, it damages arteries, it damages brain, it damages kidneys. And so the point is reduce the carbs, get the sugar out, and then can you repair your kidneys? That's the bigger question. The liver is easy to repair. It's like a workhorse, it's strong. The kidneys are fragile and they got the little tubules inside and they need to be repaired. And if you've seen me talk about the mechanism, the most common mechanism of chronic disease, the lactic acidosis, it's the liver that gets rid of 85% of the lactate. And the kidneys get rid of 15% of the lactate. So kidneys do a little bit of work, but mostly the liver. And I should back up and say of all the lactate that your body produces, in total, it gets rid of 75% of it. The other 75% of lactate gets converted back into sugar by the liver. And the other 25% gets circulated around and has to be excreted out. So back to the kidneys. So I have a guy now who he did not have diabetes. He had some excess toxic medical therapies performed, and that ruined his kidneys, and his GFR was down in the 20s. And that was a year ago, and now his GFR is in the 40s, and you want that to be above 60, depending on the lab. So 1 year later, he's got a lot of his kidney function back, and it's not diabetes. He was poisoned basically in a hospital. So that's a good success story. I had a guy, this is many years ago, I mentioned this in a previous video. He was an alcoholic, and I put him on the right supplements, and his GFR went back up. It was like in the 40s or something, and it went back up over 60. And it took 6 months or more, and he was so happy. He went out to the bar and he got drunk, and I never saw him again. And so that's an alcoholic. That's the other person was toxic from medications. And when it comes to diabetes, or I should say high blood sugar, I've had people where the GFR was in the 40s and 50s, and we got that back up above 60. But I have very low success rate when the GFR is 10 or 9. That's when people need dialysis. And when somebody's on dialysis, I've never been able to get them off of it. And you can maybe find people on YouTube or social media that did it successfully. I have a patient who is a nutrition practitioner. Her husband, diabetic, heart patient, was on dialysis, and she had him do low carb keto and supplements, and he got off dialysis. And he was off of it for many months. And then something happened, I don't remember what it was, and he had to go back on dialysis. And that's the last I heard. So the point is, you want to prevent your GFR, your filtration rate, to go too low. You got to make sure that you want to keep it up above 60 and be healthy as long as you possibly can, because the kidneys are just so delicate. Now, I have another video where I talk about my favorite kidney supplements, and you can search on YouTube my name plus kidneys and you'll find those supplements. I don't really want to talk about them now. And I want to talk about with the eating more protein. Dr. Gundry, he's alerted us to plant poisons, not just gluten, but also salicylates and phytates and all these other plant poisons. He's still pro-vegetarian and he's still anti-meat to a certain degree. But he just came out with a video saying that protein harms the kidneys in excess if you eat too much. And I don't know where that comes from. And I've done plenty of research with clinical trials, and I don't see in the trials that more protein harms the kidneys. I do see that more protein helps the kidneys, and the kidney volume increases. The GFR goes up. The filtration rate improves the more protein somebody eats. And I had a study where they had the patients had an average 90 grams of protein per day. And then they split them into other groups. And Another group increased their protein by 20 grams. The other group decreased their protein by 20 grams. And the people that decreased their protein by 20 grams had lower GFR, which is bad, and then higher mortality, morbidity problems. And then the people that increased their protein had better kidney volume and better mortality, morbidity problems. So the more protein you eat, the better it is for your kidneys. It's as simple as that. Now, where's the confusion? I think the confusion lies in when somebody is eating more protein, their kidneys are, let me back up. When people are having damaged kidneys, they're excreting more protein. That's the protein that could be from the kidneys, or it could be muscle breakdown. You could have more protein from exercising. You've broken down your muscles by exercising, and then you pee out more protein, and you can see maybe the urine is a bit foamy or something like that. That's a sign of more protein in the urine. And that happens with me when I work out at the gym more. And then, so I worked out yesterday, and I'm drinking more water. I'm trying to drink more water. Well, today, I skipped breakfast. No, I'm sorry. No, I had four eggs for breakfast, and I skipped lunch. But I drank a lot of water, and when I went to urinate, it comes out almost clear. So my kidneys are functioning really well, but I can stress them out by working out, breaking down the muscle tissue, and my body gets rid of the proteins in the urine. It's yellow and it's foamy. So another story, I just had a guy come in last week, and that's the first time I saw him was last week. And he was a congestive heart failure patient for a few years before that. And he went on a vegan diet with a coach. And 3-4 months into it, his belly was really big with ascites, meaning fluid retention. Ascites is the term. And on his own, he quit that. And in January, he went on the carnivore diet. He also had swollen ankles and feet. Well, fast forward to now, September of 2019, and the swelling in his ankles and feet are gone from the carnivore diet. And you can see the GFR, the labs are a little bit worse over this period of time, but yet he's excreting more fluid. He's excreting more urine because the swelling here is less. He's getting it drained once a month. And the amount of drainage once a month at the clinic is less and less and less. It used to be 6 liters, and then 5 liters, and then 4, and then 3, and he got all the way down to 2.5 liters. And so the carnivore diet is helping him. Now, so anyways, the point is I put him on supplements for his kidneys. Supplements are extremely important to try to repair the kidneys. And it's just, think of it as very specific groceries in a pill form, organ-specific groceries in a pill form, a measured dose for the kidneys to repair them. So when people are going carnivore or keto to get rid of their diabetes, everything improves. Basically, that's the bottom line. That's what is seen in the research studies. And I'm just like throwing it out there that we have to pay special attention to the kidneys. Now let's talk. Let's talk about keto versus carnivore when trying to reverse diabetes. Sorry, I have 2 patients now, diabetic, and we've lowered their glucose and their need for insulin over the course of many months. One guy for 3, 4, 5 months, and the other person a year. And all these benefits are occurring. It's fantastic. And then I changed their program up and I said, eat just meat. Whereas before that, they were doing oils to fast, and they were doing low carb with vegetables every day. And when I had them go just to meat, the results weren't as good. The woman's glucose is starting to creep up a little bit, even though her ketones are still good. And so I'm just saying that if in her case and in several other cases, you don't want to go full carnivore 3 meals a day, or 4 meals a day or whatever. The fasting is very important. And the point of going carnivore would be to be able to fast 22 hours and go dinner to dinner to dinner. It's during the fasting time when tons and tons of healing occurs. So it is my opinion and my experience, and I have read some other, Dr. Ted Naiman, I follow him on Twitter, and he's mentioned this before. You can have too much protein when you're diabetic and you're trying to bring down your insulin, you're trying to bring down your glucose. If you're eating too many times a day and too much protein, then yeah, you're hindering your ability to reverse the diabetes. And I've seen it clinically twice now that I'm mentioning. So the point here is fasting is super, super important. Okay, so, and it's all therapy, right? The higher protein meal, like at dinner time, and then the 20-hour fast, which is super important. And the meal gives you so many, calories that'll keep you going for 20 hours, and the fat and protein to keep you satisfied. But you got to give your body a break, because the problem has always been food. You've been eating the wrong food. So stop eating food, right? Step number one. And then step number two, when you're eating food, make sure it's the Homo sapiens diet, the sapien diet, meaning that's the fat and protein from animal sources. All right, these are my thoughts I wanted to share with you. Here, let me see if I had something else. I take notes, I just carry this stuff around in my pocket and I pull it out and I'm quickly writing it down so I can share it with you later. Yeah, I mentioned that. Yeah, and I've seen several times by various other healthcare professionals on especially Twitter, like this, it's totally a myth that protein causes harm to the kidneys. Like, if you think it's true, show me the trials. I would like to see that. Because when I've done a few searches in the recent past, I've not found that. I've always seen that more protein does not cause any change with the kidneys, or it makes the kidneys better. All right, cool. All right, thanks for listening. I'm going to answer some questions I got just off to the screen. I have a series of comments and questions, and a lot of times people say hi. So hi. All right, I'm going to scroll up to the top. Which supplements are good for hair thinning, hair loss? Good question. Always try to find the cause. And there are some videos I've seen showing that this whole thing about male pattern baldness is a myth. There's something going on inside the body that's causing the hair loss. So I'm telling you, when I moved into that moldy house, in 2007 or 2008, I didn't know it was moldy, but on month number 5, I was constipated. And on month number 6, I was losing my hair. And I'm in the shower going like this, and I would have the white shampoo and I would count 25 or 30 strands of hair, in my hands. And I'd be like, I'm going to be bald in 3 years at that rate. But here it is, more than 10 years later, I still got my hair. So get to the cause. And then there's a company, and I don't sell it. It's actually multi-level marketing, called Nutrafol, Nutrafol. And they have some clinical trials to back up the efficacy of their product. And when you look at the ingredients, it's not anything like phenomenally mysterious or technologically advanced. It's like vitamin B1, and it's pretty simple stuff. But I guess they've picked the exact right nutrients, and they have the exact right dose, and then the exact, it's like 4 pills a day. And of course, whenever you're trying to fix your hair loss, you always have to give it months, at least 3 months before you see a change. Now, in the medical world, alternative medical world, there's PRP, plasma-rich, platelet-rich plasminogen. So you go to a holistic doctor, they extract your blood, they spin it down, they take out fibrinogen or plasma and whatever factors in your blood, and they concentrate it, and then they inject it right into your scalp. And so that has good results. I did a video on this. There's another therapy called exosomes. And so it's kind of like the evolution of stem cells. It went from stem cells to PRP. It's actually, to PRP and then exosomes. And it actually started with another therapy, I forgot, where they just injected all the joints with lidocaine and vitamin C. Prolotherapy, stem cells, PRP, and then exosomes. That's the evolution of these injected nutrients, and they facilitate healing. It's not so much a drug thing. You're not cheating on this by using some drug if you're philosophically against drugs. You're accelerating and you're enhancing your healing process. All right. I don't know which meds poisoned him. Iron and more protein for hair loss, aka red meat. Right? Yeah. I mean, like, this is protein. So if you're protein deficient, then your hair goes limp and it falls out, and your scalp is protein, your skin is protein. And all these proteins do different things. They all have, different actions. And there's actually videos made of what proteins do. So transcribing DNA and splitting DNA and moving things around. And all right. Should I take Lipitor? James Texan 808 Keto Kid. Yeah, I can't answer that question. I'm not a medical doctor. I don't talk about medications. But the research shows that Lipitor, if your coronary artery calcium score is 0, Lipitor does not help. And if your coronary artery calcium score is higher than 0, then Lipitor makes it worse. Hi from Australia. I love watching your videos. I have skin problems caused by fibromyalgia. It's itch and hurts. What are the best? That's a good question. There's a lot going on there if you have fibromyalgia. So do you have some toxicity? Do you have mold? You got lactic acidosis going on. You got to fix the stuff going on in the inside of your body. And the skin is always the last thing that gets taken care of, because the skin represents the function and the health of your liver, your kidneys, your intestines. Do you have leaky gut? Urinary system. I've fixed a lot of kidneys, and the weirdest skin problems go away. So it's a matter of fixing the stuff that's inside your body. All right, eat raw meat instead of taking supplements. That doesn't help. Well, it depends on the supplement. So like the supplement that I made, like that's like raw liver in there. But yeah, like if you want to experiment with raw meat, go for it. That's what our ancestors did. Dr. Robert Morris disagrees. He does disagree. And he needs to lose about 50 pounds at least, doesn't he? And I don't. Look. And I had a patient who was a patient of one of Dr. Morris's students. And this patient was toxic, leg pain, and she went to the student's clinic and did the fasting and did the juicing and didn't help. And she did multi-day fasting, and whatever she did didn't help her. And so I put her on a detox program, and then she got better. Within 4 weeks, she was feeling the difference, and now she's back to tending her 2 acres. Whereas before that, for a year, she's sitting in her lazy boy chair all day and all night due to leg pain. And I just think that Dr. Morris is missing my 3 favorite things: fixing the cause, fixing the mechanism, and then treating the symptoms by feeding organs to get the organs back functioning again. So in the cause section, diet's in there. But what about toxicity and what about pathogens? So you have these vegan cheerleaders. They're, everybody needs to go vegan, but you're missing all the rest of that poster board right there. And if you just focus on the diet, you're missing a lot of therapy. Okay. What are the best? Oh boy, this thing jumps around. I was gonna say what? Let's see, I missed it. What? Okay, eat raw meat, right? Doctor, what are the best supplements to take for mitral valve prolapse? That's a good question too. So you can be born with mitral valve prolapse, but if you are you develop it as time goes on, like as an adult, it's primarily because your heart is sagging in your chest. You want to like bring it back up, lift it back up in your chest so that the valves match up correctly. And I fixed this before. And I had a patient, she still comes here, and she used to work at University of Michigan cardiology as a receptionist, and she would book the surgeries and all that. And she said to me that she thought she knew all the best doctors until she met me. And she, her varicose veins were gone, and her cardiologist said she couldn't hear the mitral valve prolapse anymore, so no need to come and see me anymore. It's like those kind of stories. So again, it's a whole up and down from head to toe body repair instead of just trying to treat mitral valve prolapse. But Cataplex B, liver, you could try like Cardioplus. These are from Standard Process. Can you give me a tip for narcolepsy? I don't want to take that drug. Narcolepsy. No, I don't. I don't have a tip for narcolepsy. I'm sorry. Do chiropractic radiologists treat patients or do they only interpret imaging tests? Well, the chiropractic radiologists will have a subsection of their business where they're reading x-rays or MRIs or whatever, and then they have another section of their business where they're adjusting spines, so they can do both. You just described me, K Cromwell 82. I'll go back to eating when blood glucose is low. Okay. Watch Cole Robinson for motivation. He's awesome and has days worth of content. Yeah, isn't he the snake diet guy? I heard a podcast with him. He's super high energy and he's very entertaining. Some of these comments are hidden and I have to unhide them. Stage 4 prostate cancer. Can you help him? So this is for Kristen Jennings. You got to get that book, How to Starve Cancer from Jane McClelland. And step 1 is read that and get on her Facebook page, off-label and off-patent drugs for cancer therapies or something like that. And just start talking to a bunch of people regarding stage 4. Here's this. It's from Kristen Clore. Hi, Kristen. More on the Homo sapiens diet. Same as carnivore, yes. Can you have veggies and berries on Homo sapiens diet? Yeah, basically, there's different words for different diets, but it's all basically the same thing, starting with even the Atkins diet, where it's like the majority of your calories are, animal products. And before that, it was University of Indiana, protein-sparing modified fast. And other people took different names. And now Michaela Peterson hers is called the Lion Diet, where you just eat ribeyes. And that's for people who are really sick and really sensitive to food allergies related to plant consumption. So, yeah, the Homo sapiens diet comes from Brian Sanders, and he's coming out with a movie called Food Lies. So I listened to his podcast, and that's the term that he created to kind of place the term into our brains. Like people say, is ketosis okay when I have a thyroid problem? Or is ketosis okay when I'm pregnant? Or is ketosis okay? And instead, what if you change the name of the diet to the Homo sapiens diet? So then the question becomes, is the Homo sapiens diet good for me when I have a thyroid issue? Is the Homo sapiens diet good for me when I'm pregnant? Well, yeah, you're a Homo sapiens, right? So eat the diet that your body's designed to eat. So that's why Brian Sanders changed that name. I think is brilliant. Okay. Yeah, you can, Robert CS 68. You can also eat meat, chicken, turkey, fish. Yes. I'm going down platelet-rich plasma. Thank you. What about oxalate dump when starting carnivore? I don't know how to answer the question. When people ask the question, what about? This starts with what about? I don't know how to answer that kind of question. Extended fast and last time I was reading and somebody used the word HELL and I actually verbalized it. There's no swearing on my channel. So don't swear. And 4-letter words are bad. And I just tweeted out that epidemiology is a 4-letter word. Is it true that growing children and pregnant women need more insulin in their body to help nourish and grow? No, I have not heard that. What are your favorite supplements to help improve protein while increasing protein? To help improve, not sure how to answer that question. I'm type 1 diabetic, diagnosed almost a decade. Okay. Ask me a question. Okay, I'm all the way down to the bottom. Swollen lymph nodes on SP protocol, fasting 36 hours, 1 day per week in keto ideas. Yeah. So your lymph nodes are swollen. That means your lymphatic system is congested, and people can feel it here sometimes. It's just like too much, they close their arm and it's like there's something there, or they'll feel it here. And so there are supplements for that. And 2 of my favorites, 1, Lymphanest. It's a liquid from a company called Marco Pharma. 2, Lymphatic Support from a company called Cellcore Biosciences. And those work all the time. Sometimes they give a person one or the other, sometimes both. I've never seen them not work. Dry fasting for candida. Dry fasting somebody was giving me a hard time recently about, I don't talk about dry fasting enough. I've had a couple of people do it. I've never done it. And that's where you're drinking no water. Now there's a soft dry fast and there's a hard dry fast. The soft dry fast means that you're still taking a shower, you're still brushing your teeth, but you spit the water out. A hard dry fast means you're not taking a shower, you're not brushing your teeth, you're not touching water. And what happens is your body breaks down the fat, and it turns, and it'll release oxygen and combine it with hydrogen from the air and form water inside your body. The water comes from the body making it from fat. And I've had people say it was the best thing they've ever done for their health ever. I had one guy say that he had one problem for a couple of decades, and in one 36-hour fast, it was completely resolved. So I don't personally feel confident enough to walk somebody through this, but there's plenty of people on social media, and you can do some searches and hear other people's stories about that. Now, I did see something very interesting on Twitter recently, and it was a picture of somebody's diabetic foot. They were going to get it cut off because it was like basically one big open sore, and they did a 7-day dry fast. And on the day 7, they took another picture of the foot, and it was like 60% or more healed. It was phenomenal. So dry fasting, yeah, something that as a society we should at least start with fasting, but dry fasting, we need to explore that more. Okay, yeah, Snake Diet Guy promotes drinking urine. You don't have to drink urine. You can just take a supplement from Standard Process called AC carbamide. And the point of that product, the carbamide word means urea. And when you add that nutrient into the body, into the kidneys, then it's facilitating this process of making urine. So yeah, and that was invented, in the 1950s, and it was called carbamide. But the government came down on Standard Process and said, you can't sell that. And because they had declared it an inert or inactive material. So you can't sell something that doesn't do anything. This is the government, right? They're all insane. So what Standard Process did was they added a little bit of vitamin A and a little bit of vitamin C, and they put that into this inert carbamide, and that's the AC carbamide. So maybe I shouldn't have said that. All right, but I said it, so you just heard it. 24-hour dry fasts are so easy from Keelan Blackburn. Yeah, that's something I should probably try to do. And there are days, and I didn't drink water for at least 10 years for a long period of time just because I was never thirsty. My kidneys work really well. And there are still days now where I'll go all day without drinking any water and not think about it and not eat any food. So maybe I've done a 10-hour fast. I don't know. We'll have to see. I just need to check it out. Okay. Best advice for eating fasting when sick with a flu-type virus. Thanks in advance. You give great advice. Thank you. If you're sick, pay attention to your appetite and do what your appetite tells you to do. And it may be best that you just don't eat any food. Listen to your body. Let your body tell you. Okay. What would you say about a green juice fast for type 2 diabetes? Not a fan, because it's basically just sugar, right? Think of the whole point of eating greens and a green juice and wheatgrass juice and all that celery juice. The whole point of that in the marketing of that is the micronutrients, right? But the micronutrients aren't nearly as important when it comes to reversing type 2 diabetes. It's the macronutrients by far so much more important. And so we're kind of winding down, but let me give you this fantastic story about a guy that he was fasting. He was way overweight, and he was in 200 days of water only fasting. But the point is, before he started fasting, his minerals he didn't have minerals in his blood, right? They did a blood test and he was nutrient deficient of micronutrients. And then he started fasting, and within a couple of weeks, his minerals were back. So not eating food made the mineral levels in his body go up, because the diabetic sugar-laden arteries and blood are sticky, and fluid is sticky, and things get hard, like tissue, like arteries, like joints. As people eat more and more sugar, nutrients get locked down and they don't move around. And then when this guy got into ketosis, now he's fat fluid, and the minerals get ionizable. They leave the tissue and now they get into the bloodstream and they go wherever they need to go, whether it's out the body or into the bones or whatever. So just by getting into a fast, getting into ketosis, eating the right diet, you increase your micronutrients in your body because they get dislodged or unlocked, if you will. That's brilliant right there. That's Mother Nature taking care of us. Okay. Vegan destroyed my health, especially plant-based protein. Exactly. The plant-based proteins are not like the Homo sapien diet. You're doing pills, you're doing not whey protein, sorry. You're doing like rice bran protein and all that stuff, right? In large quantities, like we never really got large quantities of protein from plants ever in our history. But yeah, from animals, certainly. That's what our bodies are designed to do. Dr. Gundry was just in this video was talking about eating 30 grams of protein per day. Are you kidding me? That is crazy low. That's like starvation low. And he said, well, we recycle our protein. Yeah, but you do it long enough, you're going to need to feed, eat more protein, like eat your pounds in grams. So I weigh right now 178, and I'm trying to get that much every day in grams of protein. All right. Carbohydrates give me sleep apnea. Even oysters affect me. Can this be reversed? I've noticed dry fasting and strict carnivore beef and eggs helps. Right. There are people who get off the carbohydrates, their sleep apnea gets better for sure. Their brain's working better. The brainstem that tells the lungs to breathe, that gets better. They lose weight. This all gets smaller up in here. No more obstructive sleep apnea. And their snoring goes away. I had a guy, remember, he told me that the day that he would eat carbohydrates, the snoring came back and it was very loud, very disruptive. And when you avoided carbohydrates, he had no snoring whatsoever. There's the best cure for snoring. So lowering your carbs, eating the Homo sapiens diet is the best cure for basically everything and the best prevention for basically everything. And when talking about toxicity, there are obvious jobs, professions where people get toxic, like welders or people that work in car washes all the time with the car exhaust, and dentists are breathing in mercury all the time if they don't take care of that. And so they need detoxification, but yet still the keto diet is the basis for detoxification. And but there are people too who they walk around, they've never had a toxic job. Their house is pretty clean. Maybe they have one filling or no fillings, and they don't even eat fish. There's no mercury in their diet, but they still are toxic because they have lost their innate ability to clean their body out just genetically. They're born in a way, their genetic expression did not allow them to detoxify their body fully. So, all right, it's been like more than a half hour. I got to keep these real short. And I appreciate all your questions. It's been a lot of fun. 2 days from now, Wednesday, 6:10 p.m. Eastern Standard Time. That's my normal schedule, Mondays and Wednesdays at 6:10 right here. I still need to figure out what I'm going to do like on weekends. What would you prefer? Let me know below. Would you prefer like Friday later in the day, maybe Friday morning, maybe Saturday or Sunday? What times, Friday, Saturday, Sunday, would you like me to go live? All right, take care. Bye.